The terms, good touch, and bad touch, refer to physical contact or interactions with others, which can have either positive or negative effects on a person's physical, emotional, and psychological well-being. Good touch. Positive, consensual, and respectful physical contact. Includes gestures like hugging, holding hands, or gentle touch from loved ones, friends, or caregivers. Can release oxytocin, promoting feelings of trust, relaxation, and bonding. Essential for emotional development, attachment, and overall well-being. Bad touch. Unwanted, non-consensual, or harmful physical contact. Includes physical abuse, sexual abuse, or any touch that makes a person feel uncomfortable or unsafe. Can lead to physical harm, emotional distress, and long-term psychological trauma. Can be perpetrated by strangers, acquaintances, or even trusted individuals. Effects of bad touch. Physical injuries or harm, emotional distress, anxiety, depression, or post-traumatic stress disorder (PTSD). Difficulty trusting others or forming healthy relationships. Self-blame, shame, or guilt. Long-term psychological trauma. Identifying good or bad touch can be complex, but here are some guidelines to help. Red flags in touch. 1. Touch that makes you feel uncomfortable, anxious, or scared. 2. Touch that is forced, coercive, or manipulative. 3. Touch that disrespects personal boundaries or consent. 4. Touch that is rough, aggressive, or violent. 5. Touch that is accompanied by hurtful or degrading language. Trust your instincts. If a touch feels wrong or uncomfortable, trust your instincts and 1. Say no or stop. 2. Set boundaries. 3. Seek support from a trusted adult, friend, or authority figure. 4. Prioritize self-care and safety. Remember, good touch prioritizes consent, comfort, and respect, while bad touch involves coercion, discomfort, and harm. Healing from bad touch requires a compassionate and non-judgmental approach. If someone has experienced bad touch, seek help from a trusted adult, mental health professional, or support hotline. Therapies for treating bad touch trauma. Here are some therapies, and details how each therapy works in the context of bad touch trauma. 1. Cognitive Behavioral Therapy, CBT. CBT helps individuals identify and challenge negative thought patterns and behaviors associated with the trauma. In a bad touch scenario, CBT might identify distorted beliefs, for example, I'm to blame for the abuse. Challenge and reframe these beliefs, for example, the abuser is responsible, not me. Teach coping skills and techniques to manage emotions and behaviors. 2. Trauma-focused CBT (TFCBT). TFCBT specifically addresses trauma-related needs. In a bad touch scenario, TFCBT might create a safe and supportive environment. Educate the individual about trauma and its effects. Help process traumatic memories and emotions. Teach skills to manage and regulate emotions. 3. Psychodynamic therapy. Psychodynamic therapy explores unconscious thoughts, feelings, and experiences related to the trauma. In a bad touch scenario, psychodynamic therapy might explore the individual's feelings and memories associated with the trauma. Identify unconscious patterns or defenses, e.g., denial, repression. Help the individual understand and work through these patterns. 4. Somatic experiencing, SE. SE focuses on processing physical sensations related to the trauma. In a bad touch scenario, SE might Help the individual become aware of physical sensations, for example, tension, numbness. Use gentle, non-invasive techniques to release physical tension. Promote relaxation and regulation of the nervous system. 5. Eye movement desensitization and reprocessing, EMDR. EMDR helps reprocess traumatic memories and reduce symptoms. In a bad touch scenario, EMDR might identify target memories or images related to the trauma. Use eye movements or other forms of bilateral stimulation to reprocess memories. Reduce vividness, distress, and negative beliefs associated with the memories. 6. Art therapy. Art therapy uses creative expression to process emotions and experiences. In a bad touch scenario, art therapy might use art making to express and communicate feelings and experiences. Provide a safe space for emotional expression and release. Help process and integrate traumatic experiences. 7. Group therapy. Group therapy provides support and connection with others who have experienced similar trauma. In a bad touch scenario, group therapy might offer a sense of community and validation. Share experiences and coping strategies. Foster a supportive environment for processing emotions and memories. These therapies can be adapted and tailored to meet the individual's specific needs and circumstances. A trained therapist will work with the individual to develop a personalized treatment plan. In conclusion, understanding the difference between good touch and bad touch is crucial for maintaining healthy relationships, building trust, and promoting emotional and physical well-being. By recognizing the signs of good and bad touch, individuals can 1. Establish and maintain healthy boundaries. 2. Communicate effectively about their needs and desires. 3. Prioritize self-care and safety. 4. Seek support when needed. 5. Foster positive and respectful relationships. Remember, touch can be a powerful way to connect with others, but it's essential to prioritize consent, respect, and comfort. If you or someone you know has experienced a bad touch, there are resources available to help, including 1. National Sexual Assault Hotline 1-800-656-HOPE. 2. National Domestic Violence Hotline 1-800-799-SAFE. 3. Local mental health services and support groups. Let's work together to create a culture of respect, consent, and healthy relationships.